FUTUREquipped is a pilot project working with colleges, Scotland's innovation centres and industry to explore ways in which all three of those parties can work more closely together to further the innovation agenda in Scotland.
The aim of the project is to future-proof skills in Scotland to enable students to adapt to jobs that might not even exist yet.
If you don't have the workforce who can actually work in this environment, this digitally enhanced environment, it's not going to scale.
The project focuses on smart technologies in the home for an ageing population, and it works with students and lecturers from ICT, healthcare and built environment programmes.
The sort of natural joint point for all of these three disciplines coming together is smart housing. It kind of sounds like a really strange combination to have health and care and construction working together with ICT, but it actually makes perfect sense because everybody has a state of health and everybody lives in a built environment. We all age, and this is the big issue. How do we support people to live longer, more independently in their own homes?
Our project's about learning. We've identified there's obviously some great practice going on, but then there's maybe some other areas where that's not possible, and so we're here to look at why and what we can do to help that take place more, and that's really the purpose of our pilot.
So both health and care and construction are sectors that lag behind in digitisation by about 20 years in comparison to other sectors, and that is kind of visible also in the teaching.
Split across 3 work streams of activity. Workstream 1 focused on the college lecturers and how they do what they do, and that then fed into Workstream 2, which focused on the students and how the learning that took place with the lecturers might then be passed on to the students. And then sort of from the other end, the industry end, Workstream 3 explores how colleges can work more closely with industry to solve real world problems.
Everybody's here to learn and put their information in.
It's nice to have the idea that there's more flexibility after college to apply what I've learned.
I come from a healthcare background, so it's nice to actually see everything that is going on in the background and seeing all the different people coming together.
Collaboration, even if they do it within their own department, is a good thing.
I think this project's been really good because it's difficult now to get lecturers together, not only from the same college but other colleges.
Having had this experience, I think we've all agreed that it's been good to not only speak to people in other sectors, but speak to other people in different colleges.
The amount of smart tech that's available.
The keeping going of the communication.
You're really talking about where we are going with management of health.
We're an ageing population, and the capacity to sort of keep that ageing population in a manner that's comfortable and represents, sort of good service provision means there's a step change in the skills that are required and the way in which we do things. So we're hoping that we can play a part in fast-tracking sort of that process and making sure that the workforce is ready to respond to the changes that are taking place.